Are you guys seeing the big picture? Awesome. Or the first slide, I should say. So thank you for that introduction, Sarah. So my name is Alicia Resch. I am a child therapist at the Center for Wellbeing. I primarily work with children and families. I work outpatient as well as in some of the schools in the Wausau district. I also am a forensic interviewer at the Child Advocacy Center. So I do that as well part-time. So I'm super excited to talk with you guys all about this topic tonight. The area of anxiety has flourished, and I'm thrilled that people would like to learn more. Caregivers, school staff, professionals want to learn more about how to help the kids in our homes or community and to better handle this matter. So if you haven't received this PowerPoint, I don't know if it was sent out. No, I don't think it was. Now I can see the other faces over there. So I'm getting a no, it wasn't sent out. But I can make it available to you if you'd like. My contact information will be at the last slide. So please feel free to either email me or call me if you have questions. I'm open to any types of communication. So even after tonight, if you're like, something's like resonating with you and you're like, yeah, I want to learn more about that, or I didn't quite understand that, please feel free to reach out to me.
Alicia?
Yes.
Already something in the chat, but it just says along the topic of child anxiety, if you have time to touch on parenting a shy child, that would be awesome as well. So I don't know if you have anything like that included, but.
Sure. Okay, yeah, if I don't cover that, please remind me at the end, but I'll try to incorporate some of that as well. Trying to move. Oh, there we go. Okay, so this is just some overview and objectives of what I'm hoping to cover tonight. Given the time, the interest of time, I might zoom through some of these, but like I said, please know if you want me to go back and cover more if we have time, or if you want to reach me after tonight, you certainly can. But I want to talk a little bit about healthy versus problematic anxiety, discuss some common anxiety disorders, review key differences, explain symptoms and signs to better help with identification, and then the most important, discuss strategies on what you can do to help a child that's struggling with anxiety. So hopefully you can walk away tonight from this presentation with some applicable tools and or like resources on how to access more tools. Is there anybody that's just appearing by a phone, like calling in and can't see the slides? Do you know? No? Okay. I just wanted to be.
I'm working on downloading the PowerPoint to share as an attachment that I'll send in the email right now.
Okay. That sounds good. I just want to be cognizant because I might not read directly off the slides, but if someone was calling in, I would be cognizant to read off the slides so they're not, because I'm assuming you all can see and read as well. So healthy versus problematic. So anxiety is a normal part of our functioning. Without some levels of anxiety, we would be unable to be aware of potentially harmful situations or fears. We might not be as productive if we didn't have that healthy form of anxiety. And with kids, for example, like stranger danger as a young child. It's part of human development. Children then learn safe versus unsafe and hopefully grow out of that stage and can be learn to be at daycare, school, and or somewhere in the community once they kind of grow out of that stranger danger phase. So that's just one example. So healthy forms of anxiety might be being nervous the first day of school, worried about academics, or developmentally appropriate fear, such as the stranger danger example or monsters under the bed. So when we're looking at if anxiety is problematic or not, we're looking at a few different domains. And each disorder has different criteria to assess. But for the most part, we want to assess frequency or duration. So is it happening more often than not that we're seeing some of these problematic behaviors or anxiety? How long is it lasting? If a child is like greatly worried about their first day of school, which is common, but by the second or third day, this worry kind of dissolves and they start talking about how excited they are to go to school and see their new friends. We're probably not going to be too concerned versus a child who may express distress or verbalize really irrational fears like every day, talking about going to school. And this is going on through the whole first semester every day or more days than not. We would want to look at that very differently and see, what else could be going on there. Avoidance. So is the child avoiding certain places, people, things, activities? And how is this avoidance impacting their life? So are they avoiding school? Are they avoiding family gatherings? How is this impacting the functioning, which we'll talk about that, how it's interfering with the functioning. And then extreme distress. So are there unsafe behaviors, aggressive behaviors, full-blown meltdowns when confronted with a trigger or anxious thoughts? And we'll talk more about these behavioral signs in the next few slides, but we want to look at where is that distress and how is it being problematic. And then interfering with functioning. So how is it impacting the child? Is it causing academic issues, distress within the household? Is it causing excessive stress for parents? Is it impeding on the ability to form social relationships, friendships, family gatherings or relationships that way? So we want to look at that. So when we're looking if the anxiety is developmentally appropriate or not, we're looking if it's excessive and persistent beyond those age appropriate or developmentally appropriate timeframes. And if we're assessing a child and situation, it leans more into these problematic areas versus the normal anxiety. It may be related to a larger emotional problem. So those are the things that we want to look for. And we want to look for them because if untreated or poorly managed, it could lead to bigger issues down the road, depression, unhealthy coping skills, or lack of positive social skills, friends, or cause other problems. So it's really important to kind of understand the spectrum of healthy versus problematic. Common anxiety disorder. So I won't spend too much time on this, but I think it's really important to understand that anxiety can present itself in so many different ways. So thinking about the symptoms, but then also thinking about the disorders themselves and how different they can appear, but have a lot of similarities. So there are several other anxiety disorders in the DSM-5, which is the most current diagnostic manual. But for the interest of time and relevance, I just wanted to briefly go over some of the common disorders I see when practicing with kids, or in my practice with kids. And anxiety disorders differ based on the situations that might induce the fear or anxiety or the avoidant behaviors. And then as well as the thoughts that are associated. So that's kind of how we differentiate between the different disorders. And we differentiate them by examining the types of situations that are fear avoided. And then again, with the thoughts that might be associated. So with generalized anxiety disorder, this is a very common disorder in children that are highly anxious. And this is excessive worry or anxiety about a number of events. So it could be school, work, or family, occurring more days than not for 6 months or longer. So again, that time frame, it's at least 6 months or longer than that. And these worries could be related to like the future, like a lot of fears like what's going to happen or bad things happening. Like if there's a fear of kind of having that monster in their head, like there's always something bad that's going to happen. Separation anxiety, similar to how it sounds. This is the fear, worry about being separated from caregivers. And this is lasting at least, I think at least 4 weeks for kids. So not the first day of school and the child is fine going into week 2. This may include having nightmares or excessive worry about the death of a caregiver, refusal to sleep by themselves, being kidnapped, and so on, like just that separation piece from somebody that they're attached with. Social anxiety disorder, or also referred to as social phobia sometimes. So for kids, this must occur in like a peer setting as well, not just interactions with adults. So if we're talking about those shy kids, if we're trying to differentiate, we see this in the peers, or we would see this in the peer setting, not just interaction with adults, but then with peers, they're fine. And there's an avoidance and a fear or anxiety about one or more situations where the child may be exposed to evaluation or scrutiny by others. So for example, performing in front of others, meeting unfamiliar people, going to birthday parties, being called on in class. This is avoided based on the fear that they're going to be highly embarrassed or highly humiliated. And for this specific disorder, the average onset is like around 13 years of age, but it can appear in early childhood. But we see this, it's a lot more prevalent in those early teenage years. And then specific phobia, exactly how it sounds, is when a child or an adult as well has a fear or anxiety about a specific object or situation. And it's important to also think that this is out of proportion to the actual danger posed. So an example of this might be fear of dogs or fear of blood. And I want to point out that all these disorders have additional criteria that needs to be examined. So these are just like very snippets to explain. So please don't view these descriptions in isolation and self-diagnose yourself or your child with one of these. But if you are seeing red flags as we continue to talk, I encourage you to jot some notes down or things that might stand out to you about these different disorders or some signs and symptoms you're seeing. And we'll talk more about what to do with your concerns later in this presentation. So talking through some of those specific disorders, we've already covered some of the symptoms that we might see. So I won't spend too much time on this, but my main takeaway would be that there can be psychological, behavioral, and or physical symptoms. So I think what I alluded to earlier on is that this anxiety can present itself in so many different ways. So many times symptoms can present themselves, and I see this a lot working with schools as well, as the child being really difficult, the child being manipulative or oppositional, or just wanting to be in control, when really it could be their anxiety. And I think kids that struggle in academic settings, we see this a lot more, and it's important to understand some of these symptoms. Of course, does every child that is oppositional in school have anxiety? Maybe not, but I think it's important to look at some of these signs. We also may see difficulty concentrating, which is very common. And that makes sense if we think about the other symptoms. And if a child is worried about their parent all day, or just got called on in class and felt so embarrassed, or have fear of being called on in class, and anxiety has taken over their brain and body, they're going to have a difficult time paying attention. We would as adults as well if we were so consumed by that fear and wanting to avoid. We also may see kids trying to control situations, controlling their parents, controlling teachers, having meltdowns over changes in schedule, or these kids might also strive for that perfection. And additionally, with physical symptoms, such as headaches, stomach aches, or other GI symptoms, these can be very prevalent as well. And I want to point this out for two reasons. One, I think it's important to be attuned to these symptoms if you're trying to determine a pattern or find the root cause of a child's worry or anxiety. And two, please don't automatically dismiss these symptoms as being manipulative. Do children say they don't feel good to get out of going to school? Absolutely. But do some children all of a sudden get a stomach ache before gym class because of their social anxiety? Absolutely. So be attuned, track patterns or triggers, and don't automatically dismiss some of these signs. That's probably like the most important piece of feedback if I had to give during this whole presentation. And I would love to like talk to a school nurse. I mean, and consult with your school nurses. When are your kids going to the school nurse? You know, that would be really interesting. Strategies. What can you do to help manage anxiety? So I say manage anxiety because that's what we do. We don't eliminate it. We don't just like all of a sudden like, oh, we fixed it, today it's gone. We help children manage the anxiety, function the best they can in anxious situations, and then in return, over time, anxiety may decrease over time or subside. And then that's maybe where you might see that anxiety is no longer there. But we don't just say like, oh, okay, anxiety's gone here today, gone tomorrow. And we want them to develop skills and utilize them naturally so the worry or fear isn't an issue anymore. And as I previously stated, anxiety is normal or it can be problematic. So I'm hoping these strategies may be relevant or could be applied no matter where on the range of anxiety the child may fall. So the most important is to educate and understand. If people don't understand, it can be really hard to help, or the help may come in the wrong forms. And when I say this, I mean educate yourself as a caregiver, which you're doing right now, so kudos to you, as well as educate your child. And there's ways to educate your child in a developmentally appropriate way when you're talking to them about anxiety. And when I was a child, I don't think anyone ever mentioned the word anxiety to me. Now it's a much more prevalent topic, but help your child to understand fears and worries are normal, or that their fears and worries are normal, and that it's exactly that. It's their fears and worries. It's not them as a person. And if your child does have more problematic anxiety or diagnosis, learn what that means to them. Kids need to know that they are supported, that they're unique, and that nothing is like quote unquote wrong with them, that this is their anxiety, this isn't them as a person. So attune to the child. So pay attention to the function of their physical symptoms or behaviors. So the list of signs and symptoms and the description mentioned previously, like what do you see? What are school staff seeing? Collaborate, talk with people who see your kids in multiple settings, and then help name the problem and identify those triggers. Many kids need help developing language to talk about these topics. So I'm so grateful counselors and school staff introduce these topics, emotions, feelings, language into schools, and it's normalized in our society and hopefully within our households. But even given some of these opportunities, some kids internalize, and it's our job as adults to notice the behaviors or signs if kids aren't able to verbally express it. Silence, safety, and validate. So if a child is being triggered or having a panic attack or showing some of the signs and symptoms we talked about, such as a meltdown or tantrum, limit your words until the child is calm and able to access their thinking brains. We all do it as parents, try to talk it out when kids are upset, use too many words, but it just doesn't work like that, and it's not super effective, as you may have learned. And it usually doesn't get anywhere. And if it does seem to calm them down, sometimes kids will say, well, I was just confused because I don't really know what you were saying, but I just calmed, like, they just calm down, but they're not able to access their thinking brain. And reassure their safety. And when I say safety, I mean more like their felt safety, through a gentle touch or hug, letting them know that you're there for them and that you will help them through their problem. And this is not the same as reassuring them everything will be all right. Sure, you can tell them that, but we want kids to learn skills and take it to the next step, not just to be reassured. And sometimes that reassurance, they may view that as when they say you're fine, it might kind of dismiss how they're feeling because they're not fine. They're feeling super anxious right now. So if you're telling them they're fine, or if they're feeling very scared and unsafe and you're saying you're safe, you're fine, they don't feel that way. So it's that finding that balance of just saying, I'm here for you and we're going to get through this. And you can tell them some of those things when they're in their thinking brain and you're able to kind of problem solve. So validate their emotions, and try to avoid some of those statements like you're fine, or you do so well in math class, you shouldn't worry so much, because that's not going to change their behavior or their ability to get through those situations. And I want to point out again, we're all human. If we have any ounce of empathy in us, we reassure and make these statements all the time to people. So if you're like, oh, I do that to everybody, like we do, we're human. And is it harmful? No, but will letting them know you're there for them and helping them build skills have a better outcome to the situation? Probably. Will it work every time? No, but we try our best, right? So we want to help them build those skills. And then sometimes normalizing a time you felt anxiety, especially if your child does not have like problematic anxiety and you're helping them through a situation that is uncomfortable or new to them. Talk to them and share how you got through it. Depending on the age of the child, they may roll their eyes at you because they don't want to relate to you at all as a parent. But some kids find this reassuring to have their feelings and thoughts normalized. So if they're worried about going to a birthday party because they're only going to know one person there, and what if nobody else talks to them? You can talk about a time that you kind of stepped out of your comfort zone and went somewhere, and then it ended up being really fun, and or like starting a new job for parents, like that's just like starting a first day of school, right? Like talk to them about like, yeah, I was really nervous when I started my this new job because I didn't know anybody, and but you know what, it all worked out. I found people to talk to, I made new friends, and I really enjoy it. And just normalize that we all have some of those uncomfortable situations that take over our bodies, that make us have that pit in our stomach and that make us feel really anxious. So I mentioned before about calming the child down before going into all the talking. So calming is definitely necessary when kids are anxious or to help them manage anxiety overall. The use of mindfulness and grounding exercises can be extremely helpful. There are tons of different breathing activities for kids to do. So like, depending on the age of the child, like Sesame Street has a belly breathing video. You can do square breathing, star breathing, deep breathing. Deep breathing by pretending to blow on hot chocolate or blowing out candles, showing them how to use their belly breathing. And for the interest of time, I won't practice these with you today, but I encourage you to Google deep breathing and you will find many different options at your fingertips. And the reason that I don't want to be like, okay, I'm going to give you this one tool for you to try is because it's going to be important for you to find a method that works well with the individual child. Some kids are like, I'm not doing this. This is goofy. Like, this is weird. So find something that you're like, oh yeah, they're gonna jive with this. This is gonna be fun for them. There's a lot of catchy breathing exercises that some kids might be more interested in than others. Like a very simple breathing technique, breathe in through your nose for 4 seconds, hold it for 4 seconds, and then breathe out of your mouth slowly, and then repeat it. And having your hand on your stomach and pretend, it's a balloon when you're breathing. And you can incorporate, like I said, like pretend you're blowing out candles on a birthday cake or blowing on hot chocolate. So there's a lot of different ways that you can teach these skills in a fun way for kids. And we want to practice these skills when the child is calm. Don't expect it to work when they're in the middle of a meltdown if they've never tried these skills before. I've had parents come to me and they're like, we did this on Saturday and it didn't work. And we're like, well, we just talked about it Friday, so I'm guessing it didn't work. So we want to practice when they're calm. 5 senses activities, so used for grounding. Have the child walk through their 5 senses, spend a minute or so on each sense, seeing what they can see and hear and smell, feel, and taste. And this really helps well, especially when kids are like in their brains, like their brains can't stop racing, they're not being present. This can be really helpful, or if they're having panic attacks, or if you're just like, they're not here with me right now. Ask them what they're experiencing, or take your child for a walk and do this during a walk. What a great bonding exercise, and you can take time to see and ground, and this is helpful to keep them in that present state of mind and avoid kind of those rapid thoughts or fears. Or sometimes we'll use candy and like have starbursts and give them a starburst, and it's like, okay, what else, let's mindfully eat this piece of starburst. What are you like? Let's take the time to think it through and kind of ground them that way. Visualizing a calm place. So having a child describe or draw what their calm place would look like, and reference for them to kind of go there when needed. I've had kids draw a picture of the living room couch at their grandparents' house, because if they can picture themselves laying on their grandparents' couch, like that's the most calm place in their life. Or a beach with their favorite snacks next to them. And just like if they were there or visualizing this, like that would be their calm. And we want them to kind of have this vision. And you can do this as a parent too, or just do it fun with them. And this can be a fun way to learn about how your child would describe calm versus what we might expect from them. Then teach them to obviously think about this place when they're feeling anxious or needing their mind or body to calm down. This can be helpful to visualize at night when trying to sleep or when encountered with like the anticipation of a social situation that might be fearful for them. Guided imagery through like narrative form or like an application, like YouTube has a ton of these. So similar to visualizing a calm place, have the child relax and you can read a narrative, or listen to one on the internet to help the child calm and relax. So these might include like picture yourself in this calming setting, and it'll walk you through kind of things to think about and just kind of really relax your body, letting go of negative thoughts or feelings, kind of like a guided meditation. Exercise, get up and move. Studies have shown this improves sleep. So our anxious kids might not be up all night with these rapid thoughts and fears if that's what they're experiencing. Relieves stress and enhances our overall mood. Healthy eating plan. I am not a hater on fast food or candy, but everything in moderation, right? We've known this forever, that what we eat impacts our mind and body. So I encourage you to explore patterns of food or ingredients that might be impacting your child's well-being. improving sleep routine or the bedroom, establish a bedtime routine, incorporate calming strategies, avoid electronics and social media. I'm guilty of it too. I go to put my phone on silent as I'm falling asleep, and somehow I'm like on the internet for 25 minutes. So I have come a far way of knowing how to disengage or manage content that I read and absorb on social media, but some of our kids don't have those skills, and what they see, read, or hear on social media might be too much for them to process or can trigger their anxiety. So I'm betting they aren't shutting their eyes and going right to bed if they see something that makes them really anxious on social media. They're not going to be able to be like, okay, I'm going to put my phone down and go to bed now. These are kind of where these rapid thoughts sometimes help or impact their sleep. And it's no different as adults as when we can say like, we were up worrying all night about something. Kids do this too. So eliminating those sources of worries or distractions right before bed might be helpful. Problem solving, so ask questions. When kids have a plan, it makes the outcome less scary. So if a child is fearful of a bad grade, explore what will happen if they do get a bad grade. Let's talk worst case scenario. If they have separation anxiety or fear of being away from you, make a plan for what will happen if they start to miss you while they're at school that day. Or if they're worried you're not going to come to the school to pick them up. Okay, well, what if I don't show up to pick you up at 3 o'clock? What can you do? Even though you know you're going to be there, help them develop a plan if for some reason you don't, so they can kind of walk through worst case scenario with you. Positive self-talk, most importantly, you must model this positive self-talk yourself. Kids listen and learn, we know that. If they are only hearing these negative statements from you as a parent towards yourself, that's going to be modeled. And we all do it, but again, we just need to be, it's a great source of learning for our kids. So like if you forget to pick up groceries that were on your list at the store, which happens to me all the time, you know, beating yourself up when you stay home and you're like, oh gosh, I'm so stupid. How did I forget to get that? And now I have to go back to the store tomorrow. So now there's this other obstacle because I forgot, you know. Think about how that would play out for a child if it was applied to like their same situation. So we want to model that. And we can form scripts or positive statements that they can help, you know, engrave in their mind to help them when they're feeling anxious. Especially, and this is where that education piece comes in that I mentioned, that we can tell them this is your anxiety, not you as a person. Letting them know this is going to pass, and like we will get through this. You're not going to feel this way forever. We're going to get through this. It's going to pass. Don't avoid. So as parents, we want to protect our kids. We don't want them to be angry, sad, worried, having tantrums, having meltdowns. Removing them from situations that provoke anxiety does help in the short term, but doesn't help the anxiety in the long run or help the child to learn those skills to encounter those situations. So there's a balance there, because obviously you're not going to like expose your child to everything that makes them anxious and not have that kind of that filter of, okay, what can my child tolerate today? But we want to, like if your child is really anxious in music class, we're not going to say, okay, you know what, you never have to take a music class again. We're going to make sure, we're going to talk to the school and work it out that the school is going to make sure you don't ever have to take a music class again or ever have to go by the music classroom. We don't want to make those promises either that they're never going to encounter these situations. So if you have concerns, you're not alone. Talk with your child's pediatrician or primary physician about what your concerns or symptoms might be. Schedule an intake appointment to speak with a therapist to kind of go over what you're seeing and maybe see if there's some resources there for you. Many are covered by insurance or offer payment plans based on your needs. Communicate with the schools about any concerns and ask for help to assist with identifying triggers. Like I said, the schools see your kids like all day. Well, before COVID, I don't know what it looks like now, but sometimes on a computer screen as well. But collaborate and work together to help explore causes. So I was alluding to some of these like calming strategies and things. So I wanted to just put it out there that like Pinterest, YouTube, Google, tons of ideas. So instead of me being like, oh, here's a breathing exercise you can do, this I think is going to be much more valuable for you to explore on your own, because like I said, you're going to have to find the right one that works for you. And for their own self-regulation. You can download apps on your phone or tablet for meditation, those calming guided meditations or distractions, like they have, you know, the coloring apps or puzzles that sometimes are a nice way of distracting. And then Amazon has several child storybooks. So there's books that are for kids with anxiety, helping kind of normalize some of those. And then there's books for parents, as well as there's also child workbooks. And then there's some references. So, and that's all I have for you.